Alrighty. Hello, everyone. We're going to give folks about 5 minutes to kind of trickle in and get started. We have captions available today. That is available by clicking the CC bottom in the bottom right, or if you're on mobile, by hitting 3 dots in the bottom right corner and then selecting captions. Alrighty, so we are going to go ahead and get started. Welcome everyone to our panel on sowing safety, cultivating protections, and weeding out harmful policies during the ongoing pandemic. So our conversation today is centering around mask bans continuing to pop up, and the fact that alongside that, a lot of pandemic protections have been lifted. So disabled folks are facing heightened risks and are being disproportionately impacted, given that we are currently in kind of a place where folks are increasingly eager to move on from the pandemic. We know that COVID-19 is still an issue, and today we're going to be joined by some experts to talk about how to navigate the continued erosion of pandemic protections, the harm caused by mask bans, and some information about how we can keep each other safe. So we are going to go ahead and get started with asking folks on the panel to introduce ourselves with our name, pronouns, or if you'd rather us not use specific pronouns, then letting us know that so we can just use your name instead, where you're joining us from, and in a few words, what kind of work you do around pandemic safety. Let's go ahead and get started with Vula.
Hi, everybody. My name is Vula. Um, I use she or they pronouns. I am joining from Western Mass on Nonotuck land. I work with Long COVID Justice doing communication and design and organizing and education. And I am a white femme with purple hair, um, sitting in a chair in a teal painted room, and I have a fabulous beaded shirt on that might be hard to see.
Awesome. Thank you so much. Ngozi, would you like to go next?
Sure. Hi, this is Ngozi speaking. I use they and she pronouns. I am a Black person, also with purple hair, purple glasses, purple earrings, and a blue, orange, purple flannel. I'm based in New York City. I'm a writer, theorist, crypt, grief, and death doula. I organize with my local mask block. I'm a disability justice trainer. So I do workshops around strengthening disability politics. And I also co-facilitate a strategy clinic series around resisting COVID denialism.
Awesome. Thank you so much. Erin, would you like to go next?
Hi, I'm Erin Gray Schwartzman. I use they, them pronouns. I'm joining from Maryland today. I am a white non binary person wearing big octagon glasses with curly hair. I also have a Nothing About Us Without Us pin today. um, I am the executive director of COVID Safe Campus, where I host an ambassador program for mass distribution and supporting student advocacy, as well as doing health education and research on COVID policy changes over time. My work in general focuses on countering eugenics and health policy and public health and pushing for justice, both health justice and disability justice. Outside of COVID, I work on anti-carceral mental health and harm reduction.
Excellent. Thank you so much. And next up, we have Emmy.
Hi, I'll go on camera. Hi, everyone. My name is Emmy. I work with Wula at Long COVID Justice. We're an organization by and for people with long COVID and associated conditions, building collective efforts for racial, social, and economic justice for chronically ill and disabled people in our communities. And I am a light, tan-skinned, mixed race femme with brown eyes. I have long, dark brown hair with bangs. I'm wearing a black sweatshirt and two small gold necklaces. And I'm usually based in Brooklyn, New York, and now I'm currently calling in from Western Massachusetts.
Awesome. Thank you so much. And I forgot to introduce myself. Hi, everyone. I'm Noor. I use he or they pronouns. I'm with ASIN. And as a visual description, I am a South Asian person with big, kind of tortoiseshell glasses, and I'm in my office in front of a genderqueer flag. Alrighty, so to open things up for our first question, we are deep into the 5th year of the pandemic, and obviously things look very different than they did back in 2020 and 2021, or even just in 2023. In terms of migration measures and policies, a lot of stuff has changed. How would you characterize how things have changed? What's gotten better, what's gotten worse, and if anything has stayed the same, what stayed the same? Feel free to answer parts of that question or all of it, whatever feels best. And feel free to just kind of let me know whoever wants to take that first.
I see Ngozi smiling, but I can't tell what that means. I guess we can go and then other people can jump in.
Yeah, absolutely.
Cool. Sounds good. I think for us, I mean, we talked a little bit about what's gotten better, and then maybe Vola can chime in about from our perspective what we see has gotten worse. But on the good, the better, we've just seen more and more groups coming together to do mutual aid projects and do collective care. I think there's been a lot more, especially in the last year, people connecting the dots across different movements and issues back to not just COVID, but to disability. And then there's been more research initiatives. We might talk about this later, but even with programs like Recover, the Recover initiative at the NIH, um, there's more money going into research. Obviously, those larger research initiatives are not perfect. As Vula and I were just talking about, patients still have to fight um, for that funding and the research. There's studies on COVID and long COVID are often inaccessible, but there is more movement on that front. There's more information and knowledge at this point about treating acute COVID than we had a couple of years ago. We have solid data about the efficacy of masks and air filtration. And then I think one of the things that I have seen as like that's gotten a lot better and is again like that cross movement solidarity, but especially around other infection associated chronic conditions. I've lived with an infection associated chronic condition for over 20 years. And I think at the beginning of this conversation around long COVID, I feel like people are trying to exceptionalize COVID and not looking at IACCs or infection associated chronic conditions more broadly. And there's been some intentional effort around that. So there's a working group of people working to push the NIH to develop an office for AACCs, and I'm looking at symptoms and experiences that people experience across a range of conditions. So I find that to be, I think that's a good thing. I feel good about that personally. Yeah, so that's what I'll say about what feels better. Does anyone else want to jump in?
This is Ngozi. I can share a bit. I Yes, appreciate the question. I don't have much to share about how things have gotten better, but I agree with what Emmy has shared so far. I think things have gotten overall a lot worse. We were much safer in 2020 and 2021 when the airline industry coerced the US government into abandoning mask requirements for air travel. It was celebrated, and other institutions quickly followed suit. Where I'm based in New York City, we only have one free PCR testing site across all of the boroughs. And that's located in Crown Heights, Brooklyn, which is not close to me at all. So we don't even have enough capacity to make demands on the city to bring back free testing. Free testing sites in every borough. Medical facilities have become more hostile, and the majority of society has moved on. Other than the acknowledgement of long COVID in mainstream from funding for research, that's great. But the material interventions that we need like don't really exist on any kind of substantial scale. And we are facing some real limitations when it comes to challenging state abandonment still.
I just want to echo all of that. I don't have much to say for things getting better. I think one thing I would add here is that it's gotten a lot harder to keep doing like research on policy and tracking all of that and turning that into actual work because funding has been systematically removed to a process. And now that masks are getting criminalized and like so much has been done to propagandize like against taking precautions and caring for each other, it's a lot harder to do movement building more broadly, but I am heartened by what has persisted and the cross movement organizing that's been happening. I see hope in that, but I don't see many positives. I see a lot of harm and a lot of really scary things. So I'm glad to be here where we're talking about that.
Yes, to everything everyone has said. Some of the other, oh, sorry, this is Vula speaking. Some of the other things that Emmy and I talked about was the end of the public health emergency and all the related benefits in the US that came with that, including stimulus money, the ability to work from home, and, all these things that were connected to that, like access to masks and tests, especially free ones, And a lot of the kind of the tools that we even had are broken in terms of government websites that helped you find a PCR test versus a rapid test. A lot of those don't really work anymore, so it's a struggle for us to kind of keep our resources up to date. There was also the Medicaid unwinding that happened last year, where in the first 10 months, over 10 million people lost coverage because states got the ability to disenroll them, and to disenroll people. Um, and, another piece, like Ngozi said about the CDC, is really looking at profit more than people. And they've taken down a lot of information that was on their website and have weakened some of their guidance. We know the CDC has let us down in the past. They're not going to save us, but we also know that employers and schools and other places look to them for guidance. So we at Long COVID Justice, along with a couple other groups, including Pan Endit and Mask Together America, have been in conversation with the CDC, asking that we're reviewing the information on their website, asking for changes, and especially asking or pushing them to speak up against mask ban legislation that is spreading. I know we're going to talk more about that later. So, and I think the other thing is just that, even groups that are talking about COVID, even groups that are talking about community care and social justice aren't necessarily talking about COVID anymore or making their spaces safer and accessible. So I try to remind myself that doesn't mean that we should give up. It just means that we have a lot of work to do. And all of our movements need to keep talking to each other and trying to learn from each other, to figure out how we can build the world that we want to see. So there, I added a little drop of hope to my list of things that got worse.
Thank y'all so much. And I'm going to swap in from Noor. I am Alex Grandstaff. I am ASAN's program manager. My pronouns are they, them. As a description, I am a white person with short brown hair and bright pink glasses, and you'll occasionally see a multicolored Arctic, like movable octopus appear in the frame with me. Thank y'all so much for this. And into the next question, we'd like to talk about the reality that both earlier in the pandemic and as well as now, there have been disparities in populations of people who are most harmed by COVID-19. Can you all talk a little bit more about who has been most affected and who is at higher risk?
This is Vula. I can share about some disparities related to long COVID and associated conditions. I think that we know that for both acute, current COVID-19 infections and longer term illness and disability from long COVID, both of those are kind of revealing and making worse health disparities that already exist. So, and COVID has been so politicized, and we have so many structural issues like racism and homophobia and transphobia, and all of that is reflected in our healthcare systems, And, so especially because of all of that, we don't always have good data on all this stuff. Who had access to care, what deaths were counted as COVID, who has a primary care physician. There's a lot of like barriers that people face. But, we do have some data, and it's great that we have some groups like the Patient-Led Research Collaborative that are looking at data in different ways. So, what we do know about long COVID is that disabled people, Black, Indigenous, people of color, queer and trans people, especially Latina people, all have higher rates of long COVID. And the CDC has a website where you can look at some of this data, which comes from a self-reported survey, and you can look at it for the past 5 years, and you can sort it by different groups and populations. And, we can, yes, I mean, there's a link to it. Which that link actually goes to a page that we made that shows you how to sort the data. And one thing that we would like to see is more data and more kind of intersectional data that looks at multiple different identities at the same time, instead of only looking at each, so that it could look at, sexual orientation and race at the same time, for example. So a couple other things we know is that Black and Hispanic or Latina Americans appear to have more experiences and more health problems from long COVID compared to white people, but are less likely to be diagnosed with it, right? So all this stuff about the data is a bit complicated. And in terms of who's at higher risk, some estimates say that about 75% of Americans are at higher risk. So that's a lot. And we're also working on a new webpage trying to track some of these disparities. So feel free to send any resources or suggestions to this email address. And I'll pass it on.
This is Ngozi speaking. Yeah, it's sort of weird to hear that number of 75%, but when you consider how many people the CDC themselves said is at high risk, people who have asthma, diabetes, there are communities who don't even consider these disabilities. Due to internalized ableism, due to capitalism, we've been conditioned to work while we're sick anyway, which is really, really unfortunate on top of the other barriers institutionally to doctors. It's really difficult to then even have access to a doctor and have them believe you and get the right tests run. It's a little bit depressing, the number of systemic barriers that negatively racialized people especially have to go through in order to get some kind of care or competent treatment. From the beginning, I knew that I was high risk because I have scleroderma, which is an autoimmune condition. I'm like monitored very closely on a multi-organ level because that's how much risk my disability is without COVID. So bringing in COVID even further complicates that. And I have family members and former friends who just like cannot fathom the level of severity that the threat of COVID would bring to my life. And so when we think about like who's higher risk, sometimes people will say you don't look disabled. And there are all of these like, stigmas and notions of disability that are completely inaccurate. And so that like, the disability movement has been, fighting against that and challenging that for a very long time. So bringing in COVID, I don't know if the language of high risk is useful anymore due to how many people are at such a high risk. We're not just all at risk. There's no special category for a small percentage of us. If you've had one COVID infection, you're at high risk for tons of complications. And so, yeah, I think about like labor conditions, whose labor tends to be more exploited. We saw, early reports of the restaurant industry taking a huge hit due to the number of line cooks who are dying from COVID. I think about incarcerated people in jails and prisons in nursing and psych facilities who don't have any agency to take any precautions, who rely on the state for PPE. I'm currently trying to help somebody right now figure out how they can get an updated booster vaccine in prison when the prison facility doesn't do that anymore. They just don't do it anymore. And so, yeah, that when I think about that, I'm just like, I think about the kids, 1 in 200 kids in New York City in a 2022 report lost a caregiver due to COVID. And the largest group impacted by that were Black kids. And so just to see a lack of improvement around mitigations whatsoever is really terrifying. And I think about the kids who are going to hopefully grow up and realize what they've been subjected to. And yeah, kids are really at high risk. A whole bunch of people who don't have any agency over their bodies at this point are at high risk. And I think we have a responsibility to keep working at this because there are so many people who do know that they're at high risk and can't do anything about it.
Oh, you're muted.
Apologies, I was on mute. Thank you so much for both of those answers. I really agree. And one of the things that makes me think of is also how much like structural oppressions, especially structural racism, just create the conditions that are higher risk, like poor quality housing where people are stuck there because of redlining, and also just the lack of investment in the community creates higher risk of asthma and other conditions, or people that have to work service jobs are more exposed to a lot of viruses, and same with healthcare, and maybe more likely to just be subjected to infection so often that they develop post-infectious conditions that really make it life-threatening. And I also think about just echoing what Ngozi said about how people don't know that they're disabled. Just like people really don't understand yet, and I do believe they will one day. People don't understand largely yet that literally everyone is at risk for devastating outcomes. And because so many people don't know that they're at risk, even not disabled people, like we have to make a really strong effort to help them understand that and meet them where they're at, in addition to what we're doing for precautions, to empower them to be able to join us and take them too. Another thing I'm thinking about is just all of the ways people are forced into conditions where they don't have control over the environment. The precautions they take have to be one way because their environment, like being incarcerated, like being in a shelter, like being in a school where you can't leave, that's your housing, like being in a care situation or an abusive household. There's only so much that an individual trying to protect themselves can do, like during the violence of the system that they're in, the housing, the like institution that they're in, systematically neglecting them. And like just building on how we need to think about the kids that have been so left behind and face so much of the violence of these policies when they aren't given the agency and autonomy. So many people who have grown up with this over the past few years, with all the harm, are very much fighting back. And I think it's really important for all of us who are in this movement and have been for a long time to really follow their leadership as people who have been so disenfranchised and stuck in those situations. And I just want to give props to them for standing up and joining the movement, and us being able to do all of what we can to bring them in and support each other. That's heartening to me.
Thank you all so much. If folks don't have anything else that they want to add in on this question, I actually would like us to circle into the discussion on long COVID, and particularly what is long COVID? What are the different ways that it can show up? And what do treatments and supports look like for people with long COVID? Because I think a lot of folks aren't fully aware of what long COVID is, what they can do, and also the signs that they might have it themselves.
I guess I can share a little bit. This is Emmy speaking. Long COVID is just a set of health issues or concerns that someone can have after having acute COVID-19 infection. Usually this involves new health issues, ongoing issues, or a worsening of previous symptoms and conditions. And I'm pulling some things here. I'm going to put it in the chat, but Vula, yeah, thanks, Vula. We just partnered with the Sick Times to produce a set of written resources called Long COVID Essentials, which covers a bunch of really basic information about long COVID, what it is, what the treatments and supports are, how to talk to your employer, how to talk to your healthcare provider, how to talk to your community about long COVID and the experience of having long COVID. Because a lot of these this basic information was not available. So I'll share a little bit now, but I encourage everyone to check those out. They're the first resources of this kind that, shockingly, they're both patient reviewed, and also reviewed, like medical reviewed by some of the top long COVID researchers and doctors in the country. So I would just encourage people to check that out, but I can talk a little bit about drawing from those, what we say long COVID is. So it could be new health issues, ongoing issues, or worsening of previous symptoms and conditions after experiencing an acute COVID-19 infection. It is a biological disease that affects hundreds of millions of people globally. We consider it a mass disabling condition. It can cause significant disability and be fatal. Anybody can develop it, and up to 10% of people with an acute COVID infection will. And then there are a couple other things to know about it that are maybe commonly misunderstood about the potential for getting long COVID, but the severity of your initial infection doesn't really correlate to the potential to develop long COVID. It's like a lot of other complex chronic illnesses and infection-associated conditions. It's really can be very hard to get a diagnosis and proper treatment or care for it, in particular because it's a relatively new condition. And then every time you get a COVID infection, you increase your chance of developing long COVID. And then people with or without prior health issues can develop it. It's the way we talk is like if you've been feeling unwell long term after having an acute infection, whether or not that COVID acute infection was confirmed by a test, even you may have long COVID. You might be having changes to your memory, trouble thinking or feeling foggy, other physical symptoms that can manifest as GI symptoms. There is a wide range of manifestations. And so I don't know if that's the information you're looking for, something like really sort of basic overview of what it, how it can manifest. And it's incredibly common. I think the last statistic, and will stop me if I'm wrong, but I think it's 6% of all adults in the US have long COVID right now. And 1 in 4 people actually diagnosed with it say that it significantly limits their lives. And we can share, scientists are still studying how long COVID occurs, so we can share some links in the chat about that if that's helpful. Does anybody else want to add anything there about like sort of a basic definition of long COVID? And we can talk a little bit about how people think, the factors that people think play a role in it developing, but I want to leave room for other people.
This is Ngozi speaking. I'm definitely not a long COVID expert, but as a CRIP doula, seeing other people talk about symptoms that they're dealing with post a COVID infection, being very similar to mine, such as Raynaud's or hypermobility, I would be like, hey, that sounds like this. Have you looked into this? It's so weird. It's just very strange to know that, oh, I was right about like wanting to protect myself, seeing the number of people with just autoimmune conditions skyrocket after having a single COVID infection has been really devastating to witness. Um, it's just been awful to witness. It's so unnecessary that this is happening, and there are more and more disabled people becoming disabled every day and don't know it or don't realize it until their third infection. They just like, are conditioned to downplay their symptoms. Oh, I'm just getting older. No, 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 no. You're not just getting older. And so I appreciate the work that people have done to make long COVID information accessible and easy to understand because for us as regular people, I can speak for myself, who's not a scientist, doesn't have experience in public health or science communication, how important that is for people to, want to do this and help make this information accessible. It's really important to do. And I'll pause and pass it to somebody else.
This is Vula speaking. I see that there's a question about if long COVID can count as disability when applying for Social Security. And yes, the whole process of applying for Social Security, I would say, is pretty broken, and that is on purpose. Um, it's, but we have a bunch of resources about that on our website, including, guides written by and for sick and disabled people of how to both apply for insurance and lots of other resources and supports.
I really appreciate the work of you all at Long COVID Justice and also the CRIP doulaship that you're doing in GOSI. I very much felt that about like I also have hypermobility and other conditions that are so similar and the feeling of, oh no, we were right. And it also just makes me think of how devastating it is to like have had conditions that are neglected and watch a new group of people get additional conditions or become newly disabled and find out how much doctors are not there for us and how much the system is against us and how much so many of us who have been disabled for so long and have had conditions that overlap have had to honestly like completely DIY our care, have had to experiment with treatments ourselves, become patient scientists, like become medical professionals essentially on our own, become like health communicators out of necessity for caring for the people we love. And we shouldn't have to, but it's also often the best way to actually get care that like centers what we need and is caring and not violent. But I really feel for anyone that's new to this, and I'm sorry because it sucks. So that's honestly what I have. It's just how devastating it is to watch this happen to more people, and how much we really need each other and the wisdom of just other disabled people, because we're all we have to lean on often.
And just, I would add one other thing is that you'll hear, a common line that we hear is, well, there are no FDA approved treatments for long COVID. There's no treatments, but there are treatments and supports. And a lot of those you are going to learn through these informal networks of care and sort of like a whisper network among other chronically ill and disabled people, as we've all been doing again for a very long time. And so we have some of that wisdom, we can share through some of our resources, but yeah, there are treatments and supports available. And I'd say if you go to your average doctor, they're going to say the opposite, and that's just not true. So keep that in mind.
Thank you all so much. Is there anything else y'all want to add about long COVID before I shift us to the next one?
The best thing you can do to prevent getting long COVID is to prevent getting COVID in the first place.
Yeah.
That's the one thing I think that, we get back to, well, then how do we prevent long COVID? Layers of protection, like masking, air filtration, ventilation, testing, nasal sprays, that's out there. We have these tools available. So I just wanted to share that last bit.
No, absolutely. And I think that in combination with something like Ngozi, you brought it up, of the language is not accessible. The information is not accessible for a lot of folks. And I know that's something that's a huge deal for me personally. And like a thing that ASN, we've worked to do a lot of work around putting out plain language and easy read resources on some ways that people can protect themselves, including masking measures, vaccines, and also things like the fact that we continue to hold our gala virtually because the pandemic is still happening. And in 2024, what risk reduction measures do you all recommend for individuals or organizations to practice to reduce the chances of folks catching COVID?
This is Ngozi speaking. I think it depends on the particular conditions a person or an organization has to navigate. For me personally, everything I do is virtual. Um, Pros and cons to that. The pros, I'm not, forcibly getting sick or like forced to travel somewhere just to try to speak somewhere. But the cons are that there's been a real um, rep repression against like remote opportunities, whether it's speaking on panels, whether it's employment regularly. So that's a barrier there. So when people like come to me to ask about like how to support them with their like COVID mitigation, it depends on their access to resources, if they even included accessibility in this format into their budget, or if it's an afterthought. um, if virtual is not doable, I recommend strict layers of mitigation, investing in high quality respirators, rapid tests or molecular tests if that's available or an option, air purifiers, hybrid events, but really investing in actual online engagement, because a lot of organizations and groups don't know how to have online events in an engaging way. And I think that really deters people from wanting to engage in online events in the first place.
Uh, this is Vula. I can add to that also. I think we've said this, but we're giving you a lot of tips, and all of this will also be shared with you. So I hope we're not overwhelming you with too much information, but I'm grateful for everything that everybody is sharing. One thing that we have been trying to do at Long COVID Justice is to just gather different examples that we see of concrete examples of different COVID safer practices that people are using when they do have events that are in person or on site. We've been trying to say on site because we're still together in person, virtually in person. We've been trying to think about, not making virtual and online events seem less personal or less connected. So yeah, so we have links on our website to some different guides, even including organizations that like planned a retreat and really thought about what people were going to do before they got there and when they got there. And of course, some of this is confusing because if testing um, is part of all this, how do we have access to tests? How do we understand when to use a rapid test versus a PCR or molecular test, right? It's confusing, but there are resources out there, and I'm not going to get into the weeds of all that right now because it's probably too much, but there's links being shared that has more information. We have a short guide to prevention that we also just posted on Instagram today, and there's links to some longer, more detailed guides. Um, And I just wanted to add, other things that you can do is join or create a mask block or other mutual aid group in your area that's collecting masks and distributing them. You could also host a party where you learn how to make Corsi Rosenthal boxes, which are like DIY air filters that you can make much more cheaply than buying an expensive air filter, and they're pretty effective. So uh, we'll share more links about all that.
Well, such great resources. So another thing that I think is a really important precaution is knowledge sharing itself, like helping boost people's health literacy and understanding and grasp of solidarity as like the reason we do this, not just protecting ourselves. I think that's a solid precaution in like helping give each other the knowledge to understand what's happening and adjust what we're doing because of it. And also to be able to pass that knowledge on so we can get more people masking and more people testing and having better ventilation, all the different layers of protection. One of the things we have at COVID Safe Campus is we have our College Guide to COVID Safety, which for students is like a pamphlet that has a really quick overview of all the topics you can possibly think of to brief, to get like a solid intro on what's happening. It's still an issue. Everyone around you is getting sick. It's not just a cold, like consider this maybe COVID or a lot of other things. We all have to assume that someone in a room with us does have COVID, and act from that place of being to protect each other because we don't know who's there and we don't know even if each of us might be infected and asymptomatic. But I can add that to the chat. We have our website, just with all that information and a list of resources, as well as the pamphlet that anyone can download. While it was designed for college students, the website can be shared with anyone, with like our primer and links. And the pamphlet honestly is also useful for any audience, but I really think communication is a resource in itself. It's really empowering and important. Another thing that I've thought of is just about how much it's important to help people understand data, because no one should have to become an expert or a scientist to understand what's going on, especially when the media has gone dark, and the government isn't communicating about the situation, what we all need to be doing. So things like wastewater monitoring, like that's one of the best ways to understand exactly what is happening with COVID right now. When are the surges? Like I think that helps people understand in a tangible way. Once you give them the tools to understand it, oh, it's not over. We still need to be doing things. Wow, I'm still at risk. That's a lot happening. It also helps people figure out what are the windows of time where maybe I can go see the doctor because it's not the worst time. It's awful that we have to think of that. But I really think helping people understand data and breaking it down is a really powerful tool so people can just know when to do things. It's obviously ideal for all of us to take precautions all of the time, but anything anyone does is really important. So if, for example, noticing that there's a surge is the time that people decide, I'm going to take precautions right now, even if it's temporary, that's still something that really helps keep us safe. And maybe they'll catch on and decide that they're going to keep doing that for everyone, for themselves.
Thank y'all, and thank y'all for bringing up the fact that you can even like, I call it like home brewing air filtration systems, because they are not always financially accessible to get. And when we're talking about masking, we know that like wearing a well-fitting respirator, like an N95, a KN95, which I have boxes and boxes of these, or a KF94 can be very effective in reducing the chances of contracting or spreading COVID. But there are also the problem of some folks cannot wear a mask or cannot mask for long periods of time, such as people with disabilities and very, very young children. So the questions that we have are, how do you navigate creating COVID-aware, disability-centered spaces with that in mind? What can be done to protect everyone, including those who cannot mask from COVID and long COVID, while being accessible for both people who cannot mask, such as immunocompromised, and people such as immunocompromised people who may be at a higher risk of a bad outcome from an acute infection.
This is Ngozi speaking. I can share. So conflicting access needs come up in disability spaces often. If we want to foster cross-disability spaces that are accessible, we have to understand which requests are needs versus wants. So sometimes there will be people who are like, oh, we'll say they can't mask for whatever reasons, but it might not even be because of they have those specific needs. They're like, oh, well, what about lip reading or, some other group who might, need to see people's faces for a particular disability related reason, but it's not them, but they're using other disabled people as the reason to get out of masking. So I think that's a little bit weird, and it absolutely does happen. We actually need to just say, hey, we understand that, let's say 1/5 of the people in the space can't mask. They legitimately cannot mask because of whatever disabilities, even if it's a sensory issue, that's not a problem. But what does need to happen is that the other 4/5 of people in attendance mask and wear high quality masks, and that we have layers of mitigation such as air purifiers and screening such as rapid testing, PCR testing before and after an event. I really don't think people not being able to mask or young kids not being able to mask a is as a serious issue as people make it out to be. I think that where we get into trouble is where people see certain people unmasked and take that as a sign that they can relax and also unmask, when that's our purpose is to like accommodate one another and do our best to keep each other safe. So yeah, that's what I think about when it comes to conflicting access needs and masking.
I can go next. Apologies for my long-winded answer that's about to happen. I pre-scripted this, and it really echoes a lot of what you just said. I really think something that's important to talk about in this conversation and in advocacy movements is that disabled people have been scapegoated and weaponized by the opposition to justify removing mask policies and protections instead of finding creative ways to navigate keeping everyone safe the best we can through collective protections. And we need to have honest conversations considering the nuance that maybe we should be focusing on making masks more accessible to wear for people that can't in certain conditions, or working on other protections to compensate. For people that protect that and make sure that we protect them through policy, because some medical devices and conditions may interfere, and that's important to talk about and accommodate. And also in the current landscape where masking has been propagandized to seem unnecessary, I think the disability community needs to have more honest conversations about the gray area where maybe some people can mask sometimes, but our society has given many people an out, and to see it as black and white for themselves. And we each need to examine that. And anytime masking is there, it creates collective access to people that are highest risk, especially people that don't know they're high risk, who are especially at risk because of that. And I've seen conversations about disability inclusion hyper focus on centering individualism over collective access, true collective access, when everyone else that doing things is critical. And people need to be given the opportunity to learn and find a mask that works for them. Maybe people haven't gotten the options or been able to afford options that fit them better. That's one of the ways mask blocks are so helpful, is giving people access to those options. And it's important to have other protections like ventilation. I also find in COVID cautious spaces that collective access gets defined as extremely rigid policies where it's only N95s, lots of testing that's required, isolating in advance when not everyone can afford to do that, or have access to that. And that rigidity is an access barrier itself. We need to be able to meet people where they're at and set our policies that are realistic and equitable, and find a way to require that we keep each other safe without ending up discriminating against people and keeping people out of our spaces. And we can do that. And it's great to see all the people that are doing that. It's honestly a difficult question to answer because it's heated, and built into all of the oppressions that affect our dialogue in these spaces. And the way the medical industrial complex is continuing to use this as a gotcha, for anti-masking talking points. I'll be honest, it's scary to answer, but internet nuance is right in bad faith. Overall, I think what's important for the very complex nuance of navigating this and not to find disability inclusion in a one-size-fits-all way. Consider everyone in the room. We have to talk about it because we're all on the line, and disability solidarity in the pursuit of justice requires all of us to examine how we affect each other, what we can do better collectively. In some ways, it may be considered a conflicting access need for those of us at the highest risk whose bodies and lives can't afford one more COVID infection, getting it in the first place. But through a community health lens and a model of maintaining networks of care, we're all in this together. It's a group project, and we can figure it out somehow. In terms of recognizing specific recommendations, again, hybrid events can help meet a variety of people's needs. And then just having people who can't mask in high filtration masks have any option at all, and accepting that really makes a difference for everyone and everyone's best interests. It's not the conflict it has been framed to be. And when will public health and medicine stop manufacturing the narrative that we can't be in solidarity and find collective support for each other? And I ask this of disability advocacy as well. What can we do to evaluate ourselves and identify in this conversation? That it's about protecting each other, and that we need to stop giving people an out. And that's something that is our job to do.
This is Vula. I think y'all really covered anything that I was going to say, except that, like I said, we're always looking for more resources. One thing I have been looking for lately is resources on masks with a clear panel in case people need to do lip reading. And there are options that are surgical masks with a clear panel versus the higher quality respirator masks like the N95 or the KN95. And so I guess one of the things that has gotten worse is that a lot of places have not updated their COVID web pages in a couple of years. So what I found is like guides to masks with clear panels, but a lot of them are from 2021 and they're promoting the surgical masks, which isn't what we want to promote. So if anyone out there has any suggestions on that, that would be great. We're also trying to collect some resources around organizing that people are doing in schools and preschools, where there are some kids who might be too young to mask or can't mask for other reasons. Somebody mentioned, also that people on ventilators or with different facial differences might have trouble masking. And so the more of us that can mask, the less transmission is happening, the less virus mutation is happening, and hopefully that means that the vaccines can keep up with it. So that was just my little comment on that.
Thank you all so much. I really appreciate you delving into this messier conversation, especially because one of my very close family members cannot mask. She's on oxygen. And a big part of advocacy for her has been the fact that the pulmonary ward that she used to go to stopped using air filtration. And that's pretty bad. A pulmonary ward is for people who have breathing issues. So I appreciate y'all talking about the importance of community collective action to allow for the folks who cannot mask to be protected, as well as everyone who can mask to be protected. And the next question that we have is actually, Ngozi, it's for you in particular. Earlier in the pandemic, many places mandated masking to reduce the spread of COVID, but now we're seeing an uptick of laws banning masks. Some that were in place that were before that are now being enforced again, and some that are being newly passed. For example, Nassau County in New York recently implemented a mask ban. Additionally, New York Governor Haley Hochul and New York City Mayor Eric Adams have both publicly talked about mask bans recently. The question for you is, what have you seen or heard about since the Nassau County ban went into effect? And what are people doing locally to keep each other safe from this virus while masking is being scrutinized or criminalized?
This is Ngozi speaking. Since the mask ban went into effect, there's been a lot of apathy pretty broadly. Sometimes people will say that they're going to have some kind of protest in Nassau County and say mask ban in effect, but won't say wear a mask, won't say, stay on the lookout or, let's be in solidarity with disabled people. They're just like, just to let you know, I I even offered to support one group with masks from the local mask block, and they said no. They weren't concerned about COVID or mask bans as an issue. And they also voiced that they were concerned that wearing masks would make them further subject to state scrutiny by the cops. So that's been um, unfortunate to kind of experience and witness. People know about it and are like, oh, I'm just not going to go to Nassau County anymore. Even doing some outreach in Brooklyn and New York City, talking to people about like, hey, do you know about the mask ban? There are proposals for it to, be implemented in the city as well. And people are like, oh, that's unfortunate, but don't seem to want to fight this much. I have seen one person be arrested for wearing a keffiyeh. And so there is a little bit of momentum challenging that, but I also don't believe the people from that group um, take masking seriously as any kind of political issue or stake. Um, yeah, like I've seen attempts at building power between Palestinian liberation movements and people who are resisting and challenging the mask ban, but overall, people kind of just it like happened and now it exists, and there's not much capacity to do much beyond what people have already been doing, which is supplying, free masks, which is great. And I'm glad that people are doing that, but there's not much momentum really outside of just trying to keep each other safe and let people know that they don't have to bend to the state. Like, okay, there's a mask ban, but mask bans are unconstitutional. So if a cop wants me to take my mask off, like it's just not happening. And trying to get people to be encouraged to like hold their ground in that way because a lot of people have just given up and said, oh well, this is the law now, but no, 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 no. We're not going back to ugly laws. I refuse.
Thank you. That is really disheartening to hear that there isn't that solidarity and connection moving. And I appreciate you naming the fact of like that you can't just force people to take their masks off. This is like a health issue, and also bringing up ugly laws that we don't need to have a return to that. So we want to open this to the broader group of, in general, what can be done to fight against existing mask bans or proposed future ones? And what are your organizations doing to fight against the mask bans so that we can have like some form of public health protection there?
I can share just a few things. We have a resource list where we've just been collecting some different organizing examples from different groups around the U.S. Of things that they're doing, and it links to some toolkits that other groups have created. Um, there's also a web page called stopmaskbans.com where you can write a letter or call your elected officials, whether maybe they're discussing a mask ban in your area, maybe they're not, but people are also trying to reach out and say that we don't want mask bans in our area. Some groups are also looking at right to mask legislation and organizing around that, and trying to connect to some other movements like around anti-surveillance movements, civil rights movements, thinking about like how all these struggles are connected. But yeah, it's a really tough time, and I'm sorry to hear what is happening in Nassau County and just how much apathy there is everywhere. And I know we're saying a lot of things that are rough now, but I want to just keep saying there are still things that we can try to do, and there are a lot of people working on these things and trying to share what they're doing and what strategies they're trying. So I hope we can all keep talking about it and figuring out how to fight together. I will also add that one strategy people have used is doing some education with elected officials, and that has caused some people to switch whether or not they're going to support a mask ban based on learning and understanding more about it. So I just wanted to add that as a small example of something that has been working.
Thank you for that. And I'm going to give a little bit of buffer time because I know one of our other panelists wishes to speak as well. I think it's really important to highlight the fact that doing education on the local, the state, and the federal level with our representatives to explain the importance of why masks are important, why COVID risk reduction moves that are not just on the individual level or on the collective level are very important, are good for the health of our communities, and why mask bans actually pose a huge danger. And now I'll return the floor to our panelists.
I have a bit of an answer for the last question in the context of some other mask bans that happened, and then I'll answer this one too. One of the things that I think of is the importance of following the leadership of everywhere that's having mask bans, and also thinking about the places that had it so early on, and thinking about organizing in North Carolina. I just want to give a shout out to the groups that are really working hard on that and facing terrible circumstances. And also, one of the things that's happening that isn't as visible outside of like the context of education, but is really devastating to a lot of folks, is the mask bans that are happening on campuses that have been growing all semester. And not all of them are explicit mask bans. Some of them are implicit, where they're, the best way I can sum it up is forced mask removal policies, where policies might not explicitly ban masks, but require removal to enter residential buildings and shared spaces, exist in public at all, participate in their community or events. And I think it's really important also to contextualize that and how these policies were created to target protests and group gatherings and restrict that. And the reality is, in addition to that, these policies can be enforced anywhere at any given time. The people who are enforcing them determine when it's going to be enforced. So we all have to band together, no matter who is like directly in the area that it's affecting, or who's somewhere else where this can happen at any given time. All of us are at risk of this injustice. I think it's important to keep movement building with each other and be prepared for where it could happen next. And then another thing that I wanted to add that goes into the next question is that one of the things that is very specific to like campus mask bans is how, since campuses are where people have their housing, they're in dorms, it's where people have food they rely on in like the dining halls. When schools suspend people for things like mask bans or forced unmasking policies, when that can happen, that threatens their housing stability, their access to food. It really affects their like basic needs, and just the threat of that is devastating and creates a lot of stress, which can also create illness. So just thinking about that, it's also important for us to help support meeting each other's basic needs and supporting people that are like punished through these like policies, to make sure that it doesn't completely derail everything they need to be a person. Any level of policy just strips autonomy and is so violent and eugenic. Thank you, Ngozi, for what you're doing on this and everything that you said too. But with that, going into the next question, just I think something that I want to put out there is you can't break our solidarity across movements by banning what's protecting us, and how we care for each other. Policing can't stop to make me care, and it serves fascism, but you can't stop us from caring for each other. For what to do about it, I think using community education to push back on the idea masks aren't needed is really powerful. We have to keep shifting the narrative and pushing the Overton window, and making sure that we get people to understand and be on the side of like public health, community health, not public health, the industry, to understand why it's important and why mask bans affect them too, even if they aren't masking at the moment. Maybe they will at some point. And doing this work, advocating together, is so important because mask wearing is solidarity. It's not just individual. In terms of what we're doing as an organization at COVID Safe Campus, we're doing education to help encourage people to understand why it's important to mask and give them an in for joining not only the movement, but also taking precautions, and also knowing other precautions they can take when they're threatened by mask bans. Because for people that are disproportionately impacted and targeted by policing and profiled, it can be such a threat that people might not be able to mask anymore because of being reasonably concerned about the violence that can come from policing directly. I'm going to change that. That was passive language that is exerted like and put onto people by police. So definitely bringing more people into this and thinking of masking solidarity, encouraging people to understand what they can do, whether it's wearing a mask when they are comfortable, or knowing how to protect yourselves in a situation where it's enforced, knowing how to protect each other, and also just continue that education. The other thing we're doing is coalition building among the people that we support, like students who all are advocating for COVID safety, and really care about like cross movements and making sure we're all in solidarity with each other, and connecting with other groups working on this issue. We're tracking mask bans and forced unmasking policies across college campuses. A lot of them are sneaky and come up places that you might not expect, or become entire systems. Like the public school systems in California created like forced unmasking policies like all across the system. And I also just wanted to say we endorsed the Disability Rights California and DRADF statement on mask bans. I really encourage people to go check that out to learn more, and also just see how many groups endorse that. It's a lot. It's not just those of us that are only doing COVID policy work and COVID like advocacy and justice work that are in this. There's other organizations that are in solidarity, and we can keep bringing them in, but definitely recommend checking that out.
This is Ngozi speaking. One thing I wanted to say is that it's extremely important to hold or even build an abolitionist framework around the criminalization of masks, because there are some places where the people will say, oh, there's a health exemption. Like, of course, we don't want to have a mask ban, but if there's a health exemption, or get a note from your doctor, without acknowledging that these are still, to what Vula was saying earlier, like these are still barriers that a lot of people who are negatively racialized, multiply disabled, like may not have access to. And that the line that we should be taking is to not cede any power to the state at all, and recognize that like just because the state makes laws doesn't mean those laws are quote unquote correct or okay. Like the ugly laws were not okay. Slavery was not okay. Like we don't actually have to do what the state says, especially when we know that the state is looking to further disenfranchise us. Um, but my work at People's Hub is committed to supporting folks who are challenging COVID denialism in their local organizing, which includes the fight against mask bans. It includes strategizing with organizers around common situations that we find ourselves in. We really are just trying to help shape the collective politic around resisting COVID denialism, because there is some liberalism that we encounter in disability rights and even some disability justice political spaces that we really need to be clear about, that there is no room to negotiate when it comes to fascism and eugenics.
Thank y'all. And I really appreciate that acknowledgement that this is not a negotiable space. This is not a negotiable space against fascism. It's not a negotiable space against eugenics. And also the point of community organizing. I know we've talked about a lot of really heavy subjects, a lot of stuff that can be very disheartening for folks, especially as we have gone through, we are in year five of the pandemic. And before we open the floor in the last 30-ish minutes to the Q&A section, we wanted to have a more positive opportunity of we've also the way to talk about the ways in which we've seen people come together who are COVID cautious, that the ways in which we've seen folks pool and share resources, educate, advocate, organize against COVID. So on that note, what gives you hope?
Hi, this is Villa speaking. I can share a few things. I think we've mentioned some of these already, but you know, this idea that more people are talking about how these struggles are connected and making those connections and thinking about how our movements are stronger um, when we have that analysis and we try to build those connections. Even I think we mentioned this, but understanding that um, it seems like most of these mask bans that are being enacted and discussed are kind of using COVID as an excuse to restrict protests. And so we really need to do all that analysis, that Ngozi and Aaron were talking about specifically. And also just seeing the different resources that people are creating and um, everything from like a video of somebody who made a COVID info and resource station by getting these different supplies and putting them in a box. And they made a video of them going around and hanging them in bus stops and in libraries. And, you know, it's upsetting that that is falling on us as community members to do work of public health. But also, that's what gives me hope is our people in our community and our investment in each other, and really trying to understand what it means to put collective care into practice and to really understand that um, the different ways that we affect each other, even from the air that we're breathing in and out that could have viruses in it, right? Like my mask, masks, it's good for everybody to wear a mask, but it's more protective. Like my mask protects you and your mask protects me. Um, so just thinking about that and thinking about the different mutual aid groups that have sprung up and the ways that people are intentionally trying to build community. I got reminded of this resource on pod mapping from the Autistic Society of Minnesota, which is based on a pod mapping model from Mia Mingus and the Bay Area Transformative Justice Collective. Just thinking about who, how we're connected, who we can rely on, maybe when we're sick or for other reasons. So um, that's a sweet thing that I wanted to share. And me also laughed because I put Solange and Stevie Nicks on this list, not because I was just, glad to see some people with bigger platforms speaking up. Stevie Nicks, the musician, was talking about why she masks and why prevention is important. And Solange was talking about living with long COVID and being grateful for community. So I hope we see more people speaking up, but I don't want to rely on celebrities. I think that it's on us.
I think what gives me hope that I know isn't super visible, but is so important to acknowledge is like I've heard from so many people this year and just in the past few months who have said they recently started masking again, who have had the humility to realize that they didn't know things before and they want to make sure to educate people now and share masks and share tips and other precaution strategies. And like there are a lot of people that are getting back into it or starting for the first time, and it's never ever too late. So that gives me hope is people deciding to join us in community care or come back if they took a pause. And I really appreciate anyone that holds space for just the ways that it's never too late and bringing people in no matter what they've practiced before in their COVID practices. Everyone can start, and anyone that's practicing COVID safety is part of the care that we give each other. I'm also just thinking about all of the people who are the present future of our movement. I have to give a shout out to all of our campus ambassadors since the beginning of the program. They're all students having to navigate horrible situations in the schools they went to, and they're trapped in situations. And for the past few years, like, I really admire their leadership and the way that their movement building and innovating new ways to care for each other. And also, I find a lot of hope in all the ways that people have really built more connections between disability justice and COVID safety and COVID justice, and how all of these things are interrelated and building that into conversations. I think it's really great to see more people talking about that and just building solidarity with each other in any way. So a lot of people give me hope. Even though I started this with talking about how things are very dreary, there's a lot of people that give me hope. It's the people themselves and the movements we build.
This is Ngozi speaking. For me, what gives me hope is that people are losing faith in the state and coming to realize that the ways we organize for the first 3 or 4 years needs to shift. So what's giving me hope is seeing more autonomous organizing efforts popping up. I think people are beginning to draw connections between abuse apologism, COVID denialism, and fascism. So that actually warms my heart in terms of being able to experiment and try new things and also escalate around the ways we've been organizing.
Thank y'all. Apologies, everyone just got to see me do the scanning thing to make sure no one else wanted to speak. Thank y'all for that. And thank y'all for acknowledging the fact of like folks are becoming more engaged in the ways in which they can be a part of movement work, that we can be rooted into our communities, that we can always choose to mask again, that we can always change what our previous risk reduction work was. If we weren't taking precautions, we can up those, or we can do more than we were before. We have 15 minutes left, and I would like to be able to open the floor to some of the questions that we have in the Q&A. We may not be able to get to all of them, but thank all of y'all out there in the audience for putting these in here. Really appreciate it. We have one that asks, how can those of us who are experienced in the disability community help empower the newly disabled from long COVID?
This is Ngozi. I'll start off with answering this question as a crip doula. I think it's important just to normalize talking about disability. I know that there's a lot of shame and internalized ableism that comes really with anybody who's disabled, maybe, but people who are newly disabled and newly experiencing the spectrum of debilitation that may come with their symptoms. So I think that's one thing. And I think also just sharing your experiences if you have history of organizing as a disabled person, or just sharing disability organizing history, whether you're an organizer or not, will be a massive, massive help to people who are newly disabled and acquiring long COVID.
This is Bula. I just got slightly distracted by a doorbell. Um, but I think I'm not sure if this just got said, but just like connecting people to groups and resources and information. I think sometimes people are feeling hopeless um, when there's people around them who don't believe that long COVID exists, including like medical professionals who basically say they can't help them. Um, so, um, that's some of the stuff that we at Long COVID Justice have tried to gather, and that can also be overwhelming. um, so, we also really appreciate all the work that other different groups are doing, including like the plain language resources that you all have on your website. Um, so I just wanted to mention um, that finding different ways to connect people can help.
Thank y'all on that. Are there any other thoughts on how we can support folks who are newly disabled from long COVID as folks who are more experienced in the disability community before I add another question in? All right. I will pull another one we have. When do you walk away from initiating a discussion or sharing information and calling folks out or in? I'm picking up on passive resistance that's building up towards outright denialism in my workplace that is composed of all queer or women of color, but folks won't directly say, I don't want to do X, or I'm not sure about X when I share info and advocate for us to practice layered protections for on-site gatherings. There's that they like to have a lot. If I don't broach the subject, they won't either. And they're also not engaging in good faith or much at all when I do. I'm tired of this dynamic, but need to stay employed, and I am assessing how to protect myself while pushing others. So the core of the question is, when do you walk away from initiating discussion, sharing information, and calling folks out in?
This is Ngozi speaking. I personally would not try to push people, especially if I'm the only person in a workspace who has that particular value. If it's an organization, right? Like, okay, the individuals are queer, trans, women of color, cool, but like, are there particular like missions that the organization has? Is there a way to kind of nudge some like disability justice trainings or learnings? If people are very resistant or conflict avoidant, um, hostility towards masking is real. And for your own like well-being, if it's like stressing you out and like making you concerned about like whether these people will arbitrarily fire you one day, like I I personally wouldn't push them. I think like that this is just the reality where we're at. Just document everything. And if they're open to it or like open to hiring like an outside person to offer some of this teaching, but like it shouldn't come from you whatsoever.
Thank you for that. I think it's a really good point of things don't always have to come from us. We can outsource that, especially when there is the pressure of when it comes from a workplace and there is that pressure for our own like security and safety. And I see someone has asked about if there's going to be a follow-up email with the transcript. After the event, we will have this will be posted on our YouTube channel. And we are going to include the links. We've done our best to capture all of them. They'll be in the YouTube channel's description, and the YouTube video will have the subtitles, captions. And then we have another question. We talked about this a little bit earlier, but I think it'd be good to circle back to a round of, how do I know if I have long COVID?
Hi, this is Vula. I can talk about that. Um, there's, you know, there's not a simple test or answer. Long COVID is an umbrella term, which means it can include a lot of different symptoms. It can include other diseases or other medical diagnoses. Um, so, you know, some people are able to get a diagnosis more easily, but, you know, some people have been kind of self-diagnosing it by noticing that they have health issues after having a COVID infection. So it could be new health issues, it could be ongoing health issues, it could be previous symptoms or condition that you had has gotten worse since you had COVID. You know, we're still trying to learn more about it, like people mentioned earlier, understanding that COVID has a lot of overlap with other conditions, including myalgic encephalomyelitis and dysautonomia and hypermobility. So it's a little bit complicated. One of the new resources that we're working on is about how to get help. But, you know, talking to your doctor and coming to events like this and trying to read more about it might be helpful. I'm sorry that I can't give a more concrete answer, and feel free to jump in if there's anything that anybody wants to add. You know, one thing that you can do is after a COVID infection, you can do some kind of baseline medical testing and to see if that changes over time. That's one of the pages that the CDC took down from their website, recommended tests to do after a COVID infection. So we are, but we do have some information about that on our website, and I will put it in the chat. Sorry, this is the part where I start to fade after talking for a long time. So thanks for bearing with us.
Thank you so much, Hula. And now we've come to the end of our time together today. In our last 5 minutes, I want to thank you so much to the panelists. If y'all have any final remarks you would like to make, please do. Before I hand everything over to y'all to let y'all have those closing statements, I want to let everyone know in 30 minutes, we'll be having the second panel for this evening, Digging Deeper, Autism and Mental Health. If folks can make it, we'll love to have you there. If you can't make it, just like this panel, it will be recorded. And again, thank you so much for your time. Thank you for sharing these important resources and thoughts. And yeah, please, I'll open the floor for your closing thoughts.
This is Ngozi speaking. Thanks for having us today. I just wanted to say that, yeah, I know there were like some questions we couldn't get to, but I just wanted to say that regardless of like who quote unquote wins the presidential election, like we have a responsibility to continue challenging abuse apologism and conflict avoidance that tends to come up in these spaces. So typically what happens is some people will engage in lateral ableism, and that really kind of sabotages a lot of the work that we have done or plan to do as it relates to disability justice. So in terms of like staying principled, I think it looks like challenging organizations and people who do have resources and just continuing to openly challenge them. I really appreciate the work that Disability Divest is doing in challenging disability rights organizations who have remained silent around the ongoing genocide in Palestine. I think as it relates to disability justice organizing in general, we need to challenge the limitations of what these politics look like in general. Like having an anti-imperialist politic is great, but that doesn't begin and end with Palestine. There are multiple co-occurring genocides happening right now, deeply impacting Black and Indigenous people all around the globe. And we need to really be doing better and getting over, or at least addressing, whatever conflict avoidance we're having in these spaces, because we need to be doing a lot more. And it's not going to be easy, but it is the work that is required of us, especially those of us who live in the imperial core. Like, we are not just responding to elections every 2 and 4 years. We have been organizing for years on end, foreseeing all of this and still being gaslit and treated in a very condescending manner. It's not new, but there comes a limit and some things have to give. So we just need to hold the line.
I just want to second that. Shout out to Disability Divest and the critical work they're doing, and also just building connections between the COVID justice movement and justice for Palestinians. I think it's really important for all of us to be talking about how these things are interrelated, and just wanted to second all of that. And other than that, just thank you so much to all of you other advocates and your organizations for all the work you're doing. You give me hope too. And thank you to ASAN for this panel.
This is Vula. Yeah, just echoing what y'all just said. Thank you for all the brilliance and the wisdom and the calls to action and the just acknowledging of the tough place that we're in. But that, so, you know, we know there's a lot of work to be done, but I'm grateful to be here in this space with you all.
I guess I can say very quickly, sorry, I saw that. Just same thing, just echoing what everyone said. And also just, I know that I mostly shared what's better, what I feel hopeful about, I guess, is spaces like this. This is like a good example of cross disability and cross movement organizing, and being in a room and a conversation with all of you has been giving me a lot of hope. So thank you. Thanks for convening us.
Thank y'all. I really appreciate your insights today. I appreciate everything you've shared, and I appreciate everybody who's come out to join us today. That being said, we are at our time. I hope y'all take care. Please enjoy the rest of your days. And again, thank you so much for joining us.